Welcome everyone to the GP Training 2024 Next Steps webinar. So for those that haven't met me before, brief introduction. My name is Muhibbur Rahman. I'm a portfolio GP based here in Birmingham and Solihull. So a portfolio GP means I'm a GP with multiple roles. So I'm a partner in my own practice. I've worked in various other clinical roles. So I worked as a locum GP in lots of different practices. I work covering a clinical detox unit. I'm one of the senior GPs at a secure unit for women with significant mental health illness. I did my own GP training in Neathport Talbot, which is in South Wales. I lived in Swansea during that time. And myself and our team at eMedica have been supporting GP trainees for over 19 years now. A lot of the time now I spent teaching and supporting other doctors. Okay, so what are we going to do today? This is what we're going to cover. We're going to cover the basics of what happens when you get an offer and accept it. We'll talk about different rotations in GP training. We'll talk about key things to do before you start training. I'll give you an overview of the structure of GP training. So what will happen in your 3 years, and also what are the 3 different parts of MRCGP, which you must pass to become a qualified GP. And then we'll have the Q&A at the end. Okay. First thing though, a huge congratulations to all of you, because this has been the most competitive round ever in the history of GP training. Over 15,000 doctors applied, over 11,000 were ranked. And so to have an offer, you know, you've done really well and you must have worked really, really hard and it's paid off. So well done. You all must know, and you've probably seen, you know, people posting, there are many people who've got scores that in previous years, they would have actually been good scores and would have got an offer in many areas, you know, would have been more than enough. But unfortunately, it's just so competitive this year. A lot of doctors, even with good scores, haven't got offers. So the fact that you've got one, well done. You know, a huge congratulations. All your hard work has paid off. And, you know, it's great to see that. Okay. So what happens when you get an offer and you've accepted it? The minute you accept, your references get contacted. And then what happens is, at this stage now, your information about the offer that you've accepted gets passed on via Oriel to the individual deaneries and your lead employer. At that point, each deanery has their own process. So some of you might already have been contacted to select rotations. Some of you have already been allocated your rotations after you selected which ones you wanted. Some of you have not had any contact from the deanery. That's completely normal. That's because each deanery has their own process and their own timelines. So it might be that you don't get contacted for a few weeks after some of your friends who are in a different deanery. So don't panic. Don't worry. That's completely normal. You're going to get a whole load of emails, some from the deanery, some from your lead employer. Please read the information carefully. Often there'll be links that you can follow that will have in further details, and they'll have a support, because if you've got any queries that are specific to your deanery, contact your deanery, because asking me for something very specific to your deanery, I'm not going to have that information. Each deanery will have their own, you know, procedures for that. If there's things like, you know, you want to find someone else in the deanery, you want to make contacts, this is what the GP training support group is ideal for. So, you know, you can ask for that. But if you've got query specific to your deanery, contact the deanery. And on the main GP recruitment website, which looks like this, if you scroll down, there's regional contacts for every single deanery. So when you click this, it will open up the link for East Midlands deanery, for East of England deanery, and you can contact them and ask details for your specific program director if you need to, for example. Okay, so the team will post a link to this, and just scroll down the page. In fact, I'll just show you. Okay, so this is the main GP recruitment site. Okay, so you know it has details of the timeline for the future rounds, but down at the bottom, can you see there's regional contacts? So for example here, London and the Southeast, you know, you can then find details. Northeast, you've got specific email, you know, so you've got email and contact details for every single deanery. Okay, so anything deanery specific, please contact your deanery. Now let's make a start on rotations in GP training. So what do you think is the most important non-GP rotation to do as part of your GP training? Type it into the chat. Okay, I've let people put their own free text. I can see lots of choice, and I can already see in the chat that a lot of you have picked lots of different things. So that's the first thing that's really interesting, is that some of you think that peds is the most important. Some of you think it's A&E. Some of you psychiatry. Some of you general medicine. Some of you care of the elderly. Some of you ophthalmology, ENT. Do you see? Lots of different things, and you're all right, because there's no one right answer to what is the most important non-GP rotation. And this is a really, really important exercise, okay? I can see that actually the most popular by a big margin is A&E, followed by PEDS, and then all the rest, there's a huge spread, okay? So it really is different for everyone. So let me go through how it works first, and then I'll explain what I recommend you do in terms of what you pick. So the first thing is that, as I mentioned, that it's a deanery-specific process and timeline for things like ranking rotations. Some of you have already got them. Some of you will be contacted soon. And one of the things you might see some rotation options that say things like ITP, and people aren't sure what that means. ITP stands for Innovative or Integrated Training Program. Sometimes it's called DSP, Dedicated Skills Post. So this is where you spend some of the week in a GP practice and some of the week in hospital doing different specialties. So I actually did one of the very first innovative skills programs back in 2004 when I started GP training. It was new then. 20 years later, it's very common. A lot of you will have these. I think it's really good. I think what would be ideal is that actually you spend all 3 years in GP and just some days of the week you go and do different hospital specialties to get exposed to those specialties. I think that would be much better for the first 2 years, and then the third year full time in GP. So that's one innovative or integrated training program is. Some of you might see things like HEFT, or also known as Trailblazer Post. There's local variation in different deaneries, but often these are rotations in areas of high deprivation or areas with additional needs. So you might be working with patients, for example, who are homeless, or migrant populations, or patients with drug addiction, or other things like that. And if you're on the HEFT or Trailblazer program, there's additional learning, and they do mention that if you're going to select one of these rotations, that it's because of additional learning, you don't get any extra time to do that learning. Within the same time that you're doing everything else, you've got additional e-learning and modules and training. And so it can be more challenging, but also the nature of some of these rotations can be challenging. If you want more information about that, someone will post a link to the HEFT website. And generally, you'll do your ranking in Oriel. Some of you that get late offers, they might just send you an email with some details. It's really important that, unlike when you're applying for training, where you should only rank areas you're happy to accept a job in, when you're ranking rotations, you need to rank them all, because if you don't rank them all, they're going to randomly allocate you any of them. Okay. And so what happens is you might see a list like this, and you have to put them in order, 1, 2, 3, 4, 5. And I often get queries, what does all these numbers mean? It's gobbledygook. Sometimes in Oriel, when you click that, it will pop up a little thing that will say XYZ1 is, this particular rotation first, then this particular rotation second. Sometimes they send you an email separately with an Excel document or a link to their website where you'll see things like this, that, okay, you see here, XYZ1. So 1 means rotation 1 will be in the GP practice. Rotation 2 will be medicine. Rotation 3 will be in another GP practice. And often they'll only give you the rotations for the first year. And then you'll be allocated things in the second year at some point during year 1. In some cases, they'll allocate you for the first and second year. The third year, always, all of you are going to be in GP practice. That's fixed for everyone. Okay. Year 3 is always full-time in GP practice. You won't be doing other specialties. You won't be in hospital in the third year of training. And so first thing is, try clicking it on Oriel and see if it comes up. If not, check your spam. They might have sent you an Excel. If not, contact the deanery. I've shown you where you can get the deanery details, and then they will send you the list so that you can then see which one should I, rank how. Okay. In most deaneries, they also use your MSRA to prioritize who gets their preference, but some deaneries will allocate some rotations randomly. Okay. So how to rank rotations? I recommend that you pick things that you lack exposure or confidence to, or pick things that you're really interested in. So things you hate, things you don't know, things you love. So I'll give you an example. Let's say that you've never done an obstetrics job. You're going to see lots of patients with women's health issues when you're a GP. So if you've never had exposure to it, it would be a good idea to try to get exposure to it. Let's say you've always found skin problems challenging. If there's an option to do a skin job so you can get more exposure, because again, you're going to see a lot of patients with skin problems when you're in GP. If you've never done a PEDS job, you're going to see lots of children. try to get exposure to things that you're not confident in or that you lack exposure. The other thing to think about, though, is if you're really interested in something. So let's say you think at some point I'd like to develop a specialist interest in women's health after I finish GP training. Then if you can get a women's health rotation, you can start making local contacts. You can start maybe doing some additional things to help those things so that when you finish training, you've already got a head start. Okay. Ultimately, nobody's going to get exposure to all the specialties that they want or need to be a good GP. And that's because most of you will only do like 3 hospital rotations, maybe 4. And every single specialty is relevant and useful. And this is also something really important, that all rotations can be valuable if you have the right mindset and approach. If you have a negative or what we call a fixed mindset, then you might find that you don't get much out of any rotation compared to someone else in the same rotation in the same hospital will get much more out of it because they've got a growth mindset. Let me explain the difference too. The good news is you can change from a fixed mindset to a growth mindset. So a fixed mindset is someone that they'll get allocated something like orthopedics and they didn't want it. That wasn't one of their top choices, but when they get it, they haven't even started, but in their mind, they've decided this is a waste of time, that there's no benefit doing orthopedics if I'm going to be a GP. And so they go into it. And what happens is it becomes a self-fulfilling prophecy because anything that they do that isn't directly related to the GP, they think, I knew it. I knew this was going to be a waste of time. So for example, when they're dealing with assisting in a trauma, okay, that's not something that might be directly relevant to you in GP. But if you've got that fixed or negative mindset, you're going to get no learning out of that. Whereas someone with a growth mindset will say, you know what, as a GP, I could see anything. So whatever rotation I get, I'm going to make the most out of seeing what's relevant to me as a GP, and I'm going to learn from it. So now that same person, but I did orthopedics before I was a GP actually. Now in GP, since I became a GP, some of the skills I learned then, and then later on I did a rheumatology job as part of my training, as one of those innovative training. But like some of the skills I learned examining joints. So when someone comes in now and they've got, a sore knee, being confident in examining joints means that I'm able to assess them and explain things. Having assisted in lots of hip operations and knee operations, if I've got someone with osteoarthritis that's going to go for that operation, I can explain to them a little bit of what to expect. Okay, I've learned how to do joint injections, so that's something I can practically offer to some of my patients. And so if you go in with a growth mindset, even when you're assisting in an operation, you can ask the surgeon, what are the things that once this patient's been discharged, when would they normally be followed up? When should they mobilize? And so that when you see your patient, you can explain some of these things, okay? Try to get your ward jobs done and actively go to clinic. Again, if you just say, "Oh, my ward jobs, what am I learning from this?" You're right, that as a GP, learning to cannulate isn't that useful of a skill because it's not something you're going to be doing in the community very often, okay? But if you accept that that's part of your training and you get that done, and then actively go to the consultant and say, could I come and join you in clinic if that's okay? My ward jobs are done. And then you go in clinic and then you see, okay, these patients that have been referred in, look at the GP letter. So you start saying, okay, how can I write a good clinical letter? What kind of things is it useful for the consultant to know before they've come here? Do you see that whatever rotation you get, it can be valuable if you look at the RCGP curriculum and see what are the learning points from this, what are the diseases. It's going to start helping you for your exams later. And you've also got to be proactive to get exposure to specialties that are missing, because otherwise, none of you will get exposed to everything that you need to be a good and confident GP in the year to 18 months that you're going to be in hospital. Okay. So how can you get exposure to other specialties? Reading, doing e-learning modules or courses, registering for a diploma or a certificate. Self-directed learning. When you're in your GP practice posts, you get one session, so i.e. one half day each week for self-directed learning. This is not time off. This is for you to do learning relevant to your development as a GP. You could use some of those sessions. For example, let's say you don't have a peds job. Go and find a pediatric consultant, explain that you're going to be a GP in the area and that you'd like to get exposure because you don't have peds in your training. And would they be happy if you came and sat in clinic one afternoon a week for the next 4 or 5 weeks? And then you get that approved with your trainer, and now you're getting exposure to that. Then find someone for women's health if you don't have that. Then stroke clinic, then falls clinic, then memory clinic, then Try to use your self-directed learning to, sometimes there might be a course that you could go to or e-learning that you could do. From seeing patients in GP, every time you see a patient, try to read up the relevant guideline. Try to sort of see, is there anything else? Like you might have been able to deal with that query, but when you read up the guideline, you might say, okay, if that patient had had this symptom, actually would have been dealt with differently. And then you can proactively go on specific courses or use your study leave to get exposed to other specialties. So we run an annual course. It's called GP Live. It's a national GP conference. And we're going to turn it into a GP conference, GP update course, where we have GP-focused workshops specifically to help people get exposure, but also we update you on changes in guidelines that are going to help you in your GP posts. We're also launching later this year GP update evenings for anyone in training and qualified GPs. So you get to meet other trainees, meet qualified GPs in the area, and we'll have an hour and a half of CPD. I'll do updates on recent guidelines, on drug safety alerts, and there'll be a chance to meet other people and have a nice dinner. Okay, so watch out for those. So the GP Live, National GP course, that we've done these now since 2019. So we did Birmingham then, we did London in 2020, then it was lockdown, so 2021 was live stream. 2022 was hybrid, Birmingham and a live stream. Last year was Solihull and a live stream. We haven't fixed the date or venue for 2024, but one of the big changes is these years, these were just for trainees. This year, it's going to be for trainees and for qualified GPs, because we found the last couple of years, we started getting qualified GPs that just wanted to be updated. And so, for example, we had a consultant psychiatrist did a psychiatry for GPs workshop. Consultant dermatologist did a dermatology for GPs workshop. This is a GP with specialist interest in women's health. Did a women's health for GPs workshop. The consultant ophthalmologist did a ophthalmology for GPs. I did a GP update guidelines and some careers and exam related things. So this was the London one. This is the Birmingham venue. We've had sports medicine, musculoskeletal, ENT, lots of different specialties that you might not get exposure to. You can get exposed to by coming to events like this. So, use your study leave, use your time, be proactive. Okay, so let's talk about key things to do before training, and then I'll move on to an overview of GP training structure, MRCGP, how the GPST Plus course can help you, and then we'll take questions. So things to do before training. So first thing is to confirm or claim your job. Typically, that happens via tracks. And one of the things that happens is sometimes at this point, people get a bit of a shock because they accepted a job, for example, in Birmingham and Solihull, and then they get an email to confirm a job from a lead employer in St. Helens and Knowsley or somewhere completely different. And they think, oh my gosh, this is the wrong job. It's not the wrong job. Your lead employer just handles your contract and your pay. It is not where you're training. Your deanery is where you're training. They're two different things. Okay. So, you got your offer, that's from your deanery. When the lead employer contacts you, that might be from a completely different area. They are just handling your paperwork. That's all. You're not going to be training there. Your references, if any were missing, your lead employer might request again. You need to sort out an enhanced DBS. I'll talk to you a little bit more about that in a second. You'll get various emails to fill out forms for occupational health and might need to do blood tests for that, for your vaccinations and things like that. Sometimes people will need to submit x-rays if you're coming from outside the UK for things like TB. And then you'll be asked to fill in various forms for your lead employer so that they can get you on the payroll, they can sort out your contract, so things like that. You'll also be asked to fill out Form R, and I'm going to go through some of the key areas where I often get questions, what do I put for this bit? And for those of you that are starting in GP practice, you may be contacted and asked to fill out some forms to join the performers list. The performers list is specific to GP, doesn't exist for hospital, but to work in a GP setting, in a GP practice as a doctor, you need to be on something called the performers list. Okay, so again, there's additional forms that you might need to fill in for that. Okay, so as I mentioned, the lead employer is not always the same as where you're training. They handle your contracts and your payroll. For example, a lot of deaneries in England, St. Helens and Knowsley is the lead employer. All right, they're up north, and you might be training down south. Now, some deaneries are also lead employers. So your lead employer may be your deanery, but it may not. In some cases, it might be a health board or a trust or somewhere completely different. All right, so don't worry if you get an email from somewhere different. Claim your job and fill out the forms. All right. So some of the typical forms that you're going to be asked to fill in. You might be asked to submit a copy of your last appraisal. Okay. If you are starting GP having done a non-training post before. If you are starting and you're transferring from a training post in a different specialty, you might be asked to submit a copy of your last ARCP. If you're not working in the NHS or you've not had your first NHS appraisal, they might just ask you for details about what did you do in the last 12 months. There'll be a training agreement which outlines your duties during training that you need to complete in order for them to register you as a trainee and give you a national training number. And then a form that you all need to fill in, Form R, Part A, and the equivalent of that if you're accepted a job in Scotland is called CHURAS. And some of you will be asked to fill in Form R, Part B, and the equivalent of that is SAW in Scotland. Form R, Part A, you only fill in before you start. Form R, Part B, you have to do every year before your ARCP. ARCP is an annual review of your progression in training. Okay. So Form R, Part A, there is, again, slight variation by deanery. Generally now, you'll be filling in online via something called TIS or TSS, a Trainee Information Self-Service. Looks like this, okay, for England. Looks slightly different in Scotland, all right? And there's a guide that they'll send you a link to. Again, this is why you need to read all the emails carefully. Please go through the guide. It answers all the questions, and then there's a support that you can contact. Again, if it's deanery specific questions, you can contact them. Scotland, the equivalent of this is called CHURAS. Okay. So I'm going to go through the bits in Form R that I already seen in the group, or I've had people contact me say, oh, what do I put for this? Or that people often get struck on or make mistakes on. So the first thing is that your deanery or HEE local team, this is where you got your offer from. So for example, it might be Enfield in London. It might be Birmingham and Solihull in West Midlands. All right. It's not necessarily your lead employer. This is where you got your offer, where you're going to actually do your job. The program specialty is general practice. Training grade for all of you is ST1. The start date of training is the first Wednesday in August, so the 7th of August, 2024. Post type or appointment, there's lots of different choices. It's substantive for all of you, okay? And then another area that people get stuck on is the DBS status question. DBS is disclosure and barring service. It's basically an enhanced police check. So there's a whole load of options. I'm just going to highlight the 4 options that are likely to be, you're going to pick one of these that's going to fit for you. So if you're already in the UK, you're going to pick one of the first 2. So either you're new to the lead employer, i.e. you're not already working for this lead employer, right? Even if you worked in the NHS before, that doesn't matter. This lead employer is new to you, okay? And you're located in the UK and you require new enhanced DBS. So if you're new to this lead employer and you're not already on the update service for the DBS, you're going to select this option, all right? This is for people who are already in the UK. If you're new to the lead employer and you're in the UK and you already have subscribed to the DBS update service. Now, if you don't know what is the DBS update service, this doesn't apply to you. You would know, no one can be automatically set up for this. You would have paid for it specifically, okay? And you have to do this within certain time limits. So if you're already on the update service and you've got an update service number, select this option. Then if you're currently overseas, most of you that are currently overseas, you're going to pick this option, that I'm currently overseas and will need a new DBS when I arrive to the UK. If you're currently overseas, but you've actually already been working in the UK and have a DBS update service number, you can select this option, okay? The other options, there's various other options in between. They're not relevant to almost anyone, okay? So if you're in the UK, you're going to pick one of these. If you're either on the update service, this one. If you're not, this one. If you're not already in the UK, you're overseas currently. If you've been in the UK before and you're on the update service, pick this one. If you're new to the UK completely, you're going to pick this one. Okay, if you're not already on the update service and you're overseas, you're also going to pick this one. Okay. Now, the DBS update service. All of you should join the DBS update service. It's going to save you a lot of headache. But you can only apply to join it within 28 days of when you submit the application. So let's say you've applied for DBS, but you haven't actually got the certificate yet. Within 28 days of sending the application, you can apply to join the update service. You'll need something called a form ref, which is given to you when you apply. They'll give you a reference number. That's not your certificate number because you haven't got a certificate yet. So you put this in. Or if you actually had a certificate issued, within 30 days of the certificate being issued, you can also apply to join the update service. You need the actual certificate number to do that. If you've missed these windows, you can only apply to join the update service the next time you pay for a new enhanced DBS. The reason I recommend you do this only costs £13 a year. But if you're on the update service, just like here, that you've got the option of picking this, it speeds things up. Similarly, when you change from one job to another, if you're already on the update service, it's so easy to just give them the update service and they can check live with the police if there's any changes. Otherwise, you have to fill in a whole load of forms. You have to get your ID verified, and it can take up to a month or sometimes even longer. So it speeds things up if you're on the update service. So, those of you that haven't already had a DBS, once you've had it done, do join the update service. You need to pay for it, okay? So Form R Part A. The other question that people get stuck on is, there's a question that asks, are you going to be training full-time or percentage of full-time to enter that as a decimal? So what happens is people put in their FT or full-time, and then it shows an error and they can't submit the form. That's because you have to enter it as a number, okay? So if you're training full-time, you should enter 1. If you're training 80%, you're going to enter 0.8. If you put 80%, it will give an error. It will not allow you to submit. You've got to put it as a decimal. So look, just note these down. If you're training full-time, which is most people, you put 1. If you're training 80%, it's 0.8, 70%, 0.7, 60%, 0.6, 50%, 0.5, okay? And then that bit will be able to be submitted, all right? So that's Form R Part A. Form R Part B, some of you won't be asked to fill it in now. Some of you will be asked to only fill it in before your first ARCP. Some of you will be asked to fill it in which case just fill it in based on the last 12 months, and that's fairly straightforward, okay? It's Form R Part A that people usually get stuck on. So now I want to talk about an overview of the structure of GP training, and then the 3 parts of MRCGP. So some of you might have 4-month rotations, some of you might have 6-month rotations for your hospital jobs and for your GP jobs in year 1 and year 2. Year 3, the full year will be in GP. Almost every deanery now, the norm is to have 12 months in hospital and 24 months in GP. There are sometimes, for operational reasons, if there aren't enough GP trainers available, you might find that even though your deanery intends to have 12 months in hospital, they end up doing an extra hospital rotation. So some of you might have 16 months or 18 months because some of you have 4-month rotations, some of you have 6-month rotations, okay? If you have an innovative scheme, you might find that year 1 and year 2, or one of the years in year 1 or year 2, that you spend some of the time in GP, some of the time in hospital within the same week. All of this is deanery specific. So just wait till your rotations are allocated. Then if you've got any queries about that, contact the deanery, okay? So now let's talk about MRCGP. In order for you to successfully complete GP training and get a CCT, a Certificate of Completion of Training, and have the ability to work as a qualified GP in the UK, you must pass all 3 parts of MRCGP. It's the compulsory exit exam for GP specialty training. So there's 3 parts. WPBA's workplace-based assessment. This is a series of assessments that you're going to do right from the first year all the way to the 3rd year. There's a certain number of things that you need to get done each year to be allowed to progress to year 2. You've got to get a certain number of things ticked off in year 2 to be allowed to progress to year 3, okay? AKT is the applied knowledge test. You can only sit this once you're in ST2, so your 2nd year of training, or later. So it's 200 questions in 3 hours and 10 minutes. 80% is clinical medicine relevant to UK GP. 10% is evidence-based practice, so statistics, data interpretation, graphs, charts, types of research, types of study, that kind of thing. And 10% is organizational and admin, so practice management, the types of NHS GP contract, statutory duties of a doctor, different types of forms that you might need to know as a GP, employment legislation, things that you'll be responsible for when you have your own practice and you're employing other GPs, practice nurses, receptionists, things like that. The SCA, the Simulated Consultation Assessment, you can only sit when you're in your 3rd year of training. So this is a new exam relatively. It was only launched November 2023. So what will happen is you will, from your surgery, remotely, you will do a simulated surgery. So you do 12-minute remote consultations. 9 of them will be remote video. 3 of them will be remote telephone, where you will hear the patient, but you won't see them. And the whole thing gets recorded. They're all simulated patients. They're professional actors pretending to be a patient. And the whole thing's recorded and then marked later by an RCGP examiner. And in each one, they're looking at 3 areas. They look at your data gathering and diagnostic skills. So can you take a good history? Can you, recognize what are the relevant red flags to exclude? Can you recognize the right risk factors to explore? Can you get the diagnosis right? Then clinical management and complexity. So Do you manage it according to current guidelines? Do you think about things like follow-up, safety netting, managing other risks and other issues that may be relevant? That's the complexity. And then relating to others. So this is about your communication skills, thinking about them holistically, thinking about their social and psychological well-being as well as physical well-being, and how do you actually explain things? Okay. All of that. Are you patient-centered in your approach? So all of that is assessed in every one of these cases. All right. So they're the three different parts of MRCGP. You've got to get through all of them in order to successfully complete GP training. So in terms of workplace-based assessment, you'll have an e-portfolio, and there's various different assessment tools and checkpoints you need to progress. If you don't hit all of your checkpoints, you might have your training extended. If you find that you get an extension and you still don't meet it, they might release you from training. Sometimes people assume that just because I've got in training, I'm automatically going to become a GP in 3 years. If you don't engage and get through all the assessments, it's not automatic. It's not even automatic that you go into year 2 if you don't fulfill all the requirements for year 1. So this is really important that you sort of engage in this and make sure. So there's like 10 different types of learning log that you might need to do. And you have all these different types of assessments that you need to get a certain number each year. And these newer type of assessments that were introduced more recently that you need to get signed off. Okay. Right, so then I'm going to talk to you now about how the GPST Plus course can help you be ready to hit the ground running and make the most of your next 3 years of training, and then the rest of the time will be for Q&A. So the GPST Plus course, this we've been running for many years because doctors that we helped get into training, or doctors that got the job and then realized actually would really like to be prepared before I start training, so I know exactly what to expect and how to make the most of it. And that's really where this course came about. So we will actually cover in detail the e-portfolio. So even before you start, you know what to expect. What are the different types of learning logs? Which type of things to record in which section? How do you write a good personal development or professional development plan, which you need to do for each rotation? How to write a good entry for learning logs, okay? MRCGP workplace-based assessment will look through all of the different tools and assessments. What are the checkpoints you need for ST1, ST2, ST3? What are the different outcomes for ARCP? How to avoid getting into difficulty? How to sort of make sure that you stay on top of things. We'll also look at the common reasons that people might struggle or might get an extension or might be released from training and how you can avoid them. MRCGP AKT will go through the structure of the exam, some sample questions. We'll look at why people fail, how to prepare, when to sit, how to plan ahead. MRCGP SCA will do a sample case. We'll look at what kinds of cases that you might get, why people fail, how to prepare effectively. We'll look at how to make the most of your hospital rotations, your GP rotations, and in more detail, how to get exposure to other specialties. Which courses might you find useful to do in training, both to make you more confident in that rotation when you qualify as a GP, to get exposure to things that you didn't have in GP. But also, some of you might be aware that once you qualify as a GP, it's now a lot more competitive to get a good job compared to a few years ago. And so what are the things that might make you more attractive to an employer when you finish training that you could do during training when you have a study budget and you have study leave? Because once you qualify, often you don't have a study budget anymore, and often you won't have as much opportunity to have paid time off to go and do things like that. So we'll go through all of these courses and qualifications and more. We'll look at the specifics of the GP registrar contract. So your salary scales in year 1, 2, 3, entitlement to annual leave, study leave, your working week, what should be the structure of your training, and what are the difference when you're in GP compared to hospital. Medical legal issues in general practice. What are the common reasons for doctors to get complaints during training and when they're qualified? What are the reasons why people might get referred to the GMC, and how can you reduce your risks of those? How to become a GP with specialist interest and why you might want to develop a specialist interest and how do you go about it? And then portfolio GP. So I mentioned I'm a portfolio GP. It's a GP that has multiple roles. So what are the different roles you can include in a portfolio career? And what are some of the things that you could do during training? Because you develop a portfolio career after you finish GP training. But there's things you could do in training to get you started. And lastly, how to succeed in GP training. Okay, so, key tips to help you become a great GP and habits to get into during training. If you're not available on the day of the live course, live via Zoom on 8th of June, full day, then we do have a recording available of last year's session. And after this one, anyone that does book the 8th of June, A standard ticket includes 1 month's access to the recording, and an extended ticket includes 12 months access, because some doctors, they find that some of this stuff, they want it right before they start, but then a few months in, once they've started, they want to go over it again because they've now moved to a hospital rotation or they've moved to a GP rotation and so on. And you see from people that have attended before that one of the things is, even if you think that, oh, I've read it and I know the structure and I know that my training program will give me some training on some of these things, that knowing some of the detail and some of the practical stuff that we cover, it can just mean that you've got a clear plan for your whole 3 years. You know exactly what to do when, and hopefully you can make the most out of it, but also avoid the common things that can lead people to get into trouble. Okay, so as I mentioned, it's 8th of June. Anybody that used eMedica as part of your preparation for MSRA, or if you went to our Getting into GP training course, or you used eMedica for anything, we do have a limited number of £100 bursaries available that would give you a discount. To get that, you just need to sign up to our alumni association. Someone will post a link. It's emedica.co.uk.alumni. And so essentially, if you put in the detail and make sure the email you use is the same email you used when you subscribe to eMedica or book something with eMedica, so we can match you, and then fill in the details. And all we ask is that you tell us a little bit about, how we helped you prepare, some feedback. And when you register, it will give you a code. There's a limited number of those. So we've got 100 in total. It will give you £100 discount. And you put that code in when you're booking, it will give you that. Even if you've not used eMedica and you're not entitled to the bursary, one of the things that you can do is we've got the early bird discount, that if you book before the 8th of May, i.e. up to a month before. So I'll just show you on the eMedica website. You see we've got here GP specialty training. At the bottom is the GPST Plus course. Okay, so we've got standard ticket, includes 1 month access to the recording. The extended ticket includes 12 months access. Anybody that books before the 8th of May, if you book a standard ticket, will upgrade you to an extended ticket free of charge. So you'll save £49. So that's the talk content of what I wanted to cover today. Hopefully you've already got an idea of some of the things that you might be having to do between now and then, and an overview of the structure of training and MRCGP. Let's take questions now. And what I'll do is, if anybody got questions, please ask them in the Q&A. I've got 15 minutes to deal with queries. Okay. Someone's asked, how would you recommend a trainee starting with A&E as a first placement, especially if it's their first job, to prepare? So, a really useful thing to do if you're going to start in a specialty that you're not familiar with, you're less confident in, is get hold of the relevant Oxford Handbook. So, for example, if you're starting in A&E, the Oxford Handbook of Emergency Medicine. Okay. If you're starting in psychiatry, there's an Oxford Handbook of Psychiatry. If you're starting in pediatrics, Oxford Handbook of Pediatrics, and just read through some of the common conditions, some of the things like that. But also you could look through the NICE guidelines for some of the common presentations, just so you're getting familiar with, how things are going to be managed here. Okay, so that can be useful to give some. And the other thing is that, you'll have induction. When you start in a specialty during your GP training, they're not expecting you to know everything about that. Ask for support, okay? They expect that you're new to this specialty, that you're new to that rotation. And so there'll be induction that they have, but, it's great that you're being proactive. You could do some reading beforehand, okay? Someone asked how to apply for less than full-time, and what about deferral? Great question. So if you want to apply for less than full-time, you need to contact your program director at your deanery. You can contact the deanery. We already posted links to where to find deanery contracts. If you want to defer your start, first thing to know is that you can only defer for statutory reasons. So maternity, paternity, or if you yourself are ill. You cannot defer for any other reason. So if you cannot start and it's for another reason, you basically have to give up your offer and apply next time. But if you are going to be on maternity leave, paternity leave, or you yourself are sick, you can contact again your program director to request deferral. So contact your deanery and take it from there. You cannot defer for any other reason. Okay. Someone's asked, standard ticket is £250. If you book early, you can get 12 months access. Yes. So standard ticket is £250. Extended ticket is £299. If you book a standard ticket by 8th of May, we will automatically upgrade you to an extended ticket. So you'll get 12 months access instead of 1 month's access. Okay. Someone's asked, is it really hard to get a GP post after GP training? I wouldn't say it's really hard. It's just a lot more competitive now than it has been, say, 3 or 4 years ago. And so one of the things is that you might, just like if you imagine when you qualify as a GP, you're now at the level of a consultant. So I've got lots of friends who are consultants in various specialties. A lot of them, they might have trained in one area, but there's a limited number of consultant posts in each of the hospitals in that area. So they had to have some flexibility, and some of them had to move to take up their consultant posts. Just like that in GP, if you've got some flexibility, then you'll be able to find a job. But you've got to make sure your CV is competitive. You've got to make sure that you present yourself well. You've got to prepare for the interview. You're not going to just get a job because you turn up to the interview. You see, it's competitive. So you've got to prepare. Just like it was competitive to get into training and you worked hard and you prepared. In the same way, you might need to have some flexibility. If you're absolutely limited that, look, I only want to work in a practice within a 2-mile radius of where I'm already living, and all the practices there already have staff and no one's hiring, then if you have no flexibility, you might find, okay, then you'll have to wait until one of them retires or leaves or moves somewhere else. Do you see? Whereas if you've got flexibility and then you're willing to work, to be competitive, to prepare, and that's some of the things that we'll cover at the course. What are the things that are going to make you more competitive? And near the time, when you come to CCT, we have a whole course for CCT on things like interview skills, on how to have a great CV and covering letter. Don't worry about that now. That's for 3 years down the line. Okay. Someone asked, the program you just mentioned is about the AKT exam. No, the GPST Plus course covers all of these things. There is one session on the AKT, but the AKT is only one small part of GP training. We're going to cover all of these things. Okay. Someone asked, what specialty would you recommend a trainee starts with? So while I talked about earlier that any specialty can be beneficial, it's a good question. In terms of what specialty, it really depends. So what I would say is that if you've got UK experience, NHS experience, then if you can start with GP, seeing what it's like in a GP practice means that when you do your hospital jobs, you'll get a lot more out of it. If you're completely new to the UK and the NHS, I would recommend starting in hospital, because at least you're familiar with how hospitals work. There's still going to be a lot of differences in a new country and a new system and how NHS hospitals work, but at least the environment is familiar to you. Whereas if you're completely new to the NHS and the UK, and then you go into GP, you might find it overwhelming, because unlike in hospital, there'll be a lot of other juniors around that you can ask. There'll be, a whole team. You do ward rounds together. In GP, even in year one, after the first couple of weeks where you have induction and you'll sit in with your trainer, you're in a room on your own with patients. Yes, you have debrief and you can discuss patients with your trainer, but that can be really, really scary. And then the computer system's new, and then you're in a new place and trying to get used to a new system. So that can be a real challenge. So I'd recommend that if you've got NHS experience, starting with a GP post can be really beneficial, because you see what are the things that I'm doing as a GP. When you go to hospital now, you know how to get the most out of it. If you're completely new to the NHS, then I'd recommend starting in a hospital specialty. It doesn't matter which one, but in a hospital specialty. Someone asked, how to improve focus history for GP and OSCE? Are there any courses? Okay, great question. So we actually have a course exactly for that. I'll show you on our website. So if you look here, we've got this. It's called the GP 100 case grammar. It's in the MRCGP SCA section. And in this, we cover 100 cases. So in blocks of 5 cases at a time. For each one, I cover what are the key things to ask in history, what are the red flags, how to examine, I actually demonstrate some of them. I talk about what are the other risk factors, what are the diagnostic criteria, what are the current guidelines for management. This has been updated in 2024. Okay, so as of now, what are the current guidelines? And every 5th one, there's a simulator, and you'll see that when we film this, the audience are asking the simulated patient questions, and then they're answering them. So this is a good way if you sort of, even before you start your first rotation in a GP practice, not necessarily, like if you're starting in hospital, you might wait till later, but before your first GP rotation, if you want to sort of start getting familiar with what are the things and how might you ask them in a GP setting in the UK, this can be really good. So we cover 100 cases. All of these are covered, okay? And you can click this video to watch an example I've included of how I go through it. You can see example, some clips from case 1, okay? So have a look at that. That's called a GP 100 case grammar course, okay? That can be useful. Later on, when you get near the time of SCA, then we have specific courses for SCA. If you're coming to the GPST Plus course, we'll talk about that in more detail there, okay? Someone said, what are the options available for a GP specialist after training? So once you finish GP training, you could work as a salaried GP. So that's where you work in a practice as an employee. You could become a GP partner. So that means you own the practice. So like I'm a partner in my own practice. That means I am an owner and responsible, not just for seeing patients, but for the running of the business and for who we hire and who we work with and so on. So that has pros and cons. It's a lot more responsibility. You can potentially make more money, but you could potentially lose money. You could also work as a locum GP. You could work as a portfolio GP. You could develop a specialist interest. We'll cover some of these things in more detail here. So please do join that if you want to cover it in more detail. Someone said, how do rotations work when someone's doing 60%? Great question. So if you're doing 60%, generally you work 3 days a week. Okay. In terms of how it works, you're doing 60% of the routine work, but you'll also still need to do nights, evenings, weekends. If you're in hospital, you'll just do 60% of the on-calls. So, you might be doing 60% of nights compared to someone who is full-time. It's not that just because you're training less than full-time that you're excluded from nights, evenings, weekends. And if you're in GP, if you're doing 60%, then generally it means you do 3 days. And the specific hours you negotiate with your trainers, but you do 60% of the hours of someone full-time. Someone said, which countries are eligible to work as a GP after qualifying as a GP in the UK? Canada, Australia, most of the Middle East. However, while they recognize your qualifications, in some places, like in most of the Middle East, there are no jobs at the moment for GPs. It's saturated. But Australia, Canada, the Middle East all recognize UK MRCGP with CCT. Okay. Someone said, any tips for who's taking up GPST as the first job in NHS? So I already mentioned that if you can, contact your program director. If you can go and visit beforehand, get here as early as you can, so at least things like your accommodation are sorted. You will absolutely find coming to this, so you have a clear idea about all of these things, so that you're not overwhelmed with things like the e-portfolio and then struggle and get behind. You'll find that really helpful, so that you know exactly what to expect. Okay. Someone said, if we get a TERS post, do we get the payment in the first month's salary? So it can sometimes take a few months, but usually is given one lump sum after deduction of tax. So, you're not going to get £20,000. You'll get about £11,000 after they deduct all the tax. Okay. Someone said, how do you get previous experience recognized? You can only do that if you applied for combined training during the application, and then you need to fill in a lot of paperwork to show how is that experience meet the RCGP capabilities. Okay. So if you didn't apply at the application, you can't do it now. And if you did, but you haven't kept logs, or you can't fill in the paperwork to a satisfactory standard to show that you map to the competencies, you won't get any recognition. Okay. Someone said, is it possible to change your allocation to a different specialty after being allocated? Generally, you cannot change. You could contact your program director and ask, but generally you can't, because the issue is that if they let one person change and lots of people want to change, it becomes chaos. That's why they ask you to rank, and then they use an algorithm to allocate. So generally, what you've got is what you've got. You can still do things to get exposed to other things, and you can make the most of the ones you have got. Okay. Someone said, is it possible to change your area or deanery after you've started training? If there's a significant change in circumstances, you could apply for an interdeanery transfer. Hardly anyone is successful in getting one because there has to be a vacancy where you want to go. Or if you've got a good reason why you want to apply again to a different area, you could apply again and resit MSRA. But once you're in training, to apply again, you need support from your program director. They need to fill in a specific form to give you permission to reapply. Otherwise, your application will automatically be rejected. So if that's the case, the first thing to do is to talk to your program director. Okay. Someone said, how can we cope or adapt if we start in a hospital rotation like A&E without having complaints? We'll cover in detail how to reduce your chance of complaints no matter what specialty at the GPST Plus course. It's too much to go into in a 30-second answer. Okay, so please join. We'll cover it then. Great. Well, thank you very much, everyone. Huge thank you to the eMedica team for fielding all of those, helping me to clear the queries. Thank you so much to everyone that joined today. Once again, I really hope that you found it helpful. I just want to say that whether you're joining the GPST Plus course or not, all of us at eMedica wish you every success in your training. Once again, congratulations on all your hard work and getting training in the most competitive round ever. Okay, but I do hope to see a lot of you at the GPST Plus course so that you can really hit the ground running and be absolutely ready to make the most of your training. And that hopefully this is not the end, but the start of our journey together, because we're here to support you at every step of training and then beyond for careers. Okay, thank you so much.